Hi, I'm Dr. Pennau with Oral Surgery Associates of Colorado Springs, and today I'd like to talk to you about placing implants using CT navigation. Implants can be placed several different ways. All of the imaging that we do here is three-dimensional. We do small field CT scans to get the most up-to-date, crisp images, and we know exactly the volume and location of the bone where implants should be placed. From that, we can make diagnostic plans where the implants should go in correlation to where the restorative needs are, either with crowns, bridges, or complete denture work that will be supported by implants. Classically, what we would do was we would make our design on the 3D model and translate that from our imaging on the screen to our mind to the patient, and that's called freehand surgery. A couple of other options are using different kinds of guides. There's something called a static guide and a dynamic guide. A static guide is what people have been doing for probably the last 10 years or more. And what we do is we take an impression of your teeth, just like you would have at a dental office. We pour up a mold or a model in stone that represents your teeth. And from that, we make a guide that is generally fabricated through the CT process, and the acrylic guide is milled or printed. That goes onto the teeth for the actual implant surgery and acts as a jig or a guide for the drill to go in to get the implant in the proper location. That works very well. There is a relatively newer system that is dynamic navigation, where there's live real-time adjustments. That's using this machine called X-Guide or X-Nav, and that's dynamic live navigation. Currently, we're the only office in Colorado Springs that's using it, and it is quite helpful and useful. In some cases, using a static guide isn't practical for the back molars and things like that. The height and clearance needed to get a guide in is insufficient. So we have to revert back to doing it freehand. But if we want increased accuracy, which is going to give you an increased quality of result with your general dentist, we like to use the dynamic navigation. So what we do is on the consultation, we use a small clip such as this. This is thermoplastic plastic that sits on the teeth, and then you get scanned in the CT machine. From there, the CT machine then gets uploaded to the software on the X-Guide software. And during the procedure, you'll wear the clip in your mouth, and there's a reader here that will read the position of the clip and tell this machine where your mouth is in relation to the CT scan that we had taken. There's also a reader in the drill that I use to place the implants. So when I'm actually performing surgery, there is a communication between the drill, the CT scan, and your mouth. So as I am placing the implant, I can watch both in your mouth and on the split screen view. I know exactly the depth, the angulation, and we call it pitch, roll, and yaw of the placement of that implant to give it as accurate of a placement as possible. This doesn't work for everybody. Not everyone is a good candidate for it, depending on what teeth are there and what kind of bone we have. But it certainly is a wonderful adjunct, and it's something that is cutting-edge technology that gives us the best possibility for success for you. Thank you very much. If you have any questions, please come in, give us a call. We'd love to talk to you more about it.